Way to PACES, the right way.
Welcome to Way to PACES, one of the free sessions, and today's session is Station 2, History Taking, and Dr. Tracy will be doing the candidate. Now I'm going to sending the scenario through the chat, and I'll time for 5 minutes for preparation. Right, the scenario is you are a doctor in Respiratory Clinic. 62-year-old gentleman, Mr. David Cooper, has 2 months history of worsening breathlessness. He has a diabetes mellitus and has history of ischemic heart disease. Please take history and discuss the management. So people who are listening, I would suggest to take a pen and paper and make a note of it, because this is a 5 minutes time you need to prepare what's going on. What are the differentials? What are the questions to be asked? What are the sections of history you will ask? Everything you need to prepare it. Then while doing this scenario, I would say preferably not to send any chat messages, because that can distract the presenter. But after the consultation, you can ask questions, and then if I ask any questions, you can answer. For example, as an examiner, if I ask any questions to the candidate, please don't reply with a chat, because that will definitely distract the candidate. And also, I'm making you aware this is being recorded, and this session will be broadcasted or posted in the YouTube channels and all the social media. Way to PACES, we have got YouTube, Facebook, Instagram, Twitter, and also we got a website. And people who have not joined before the Way to PACES sessions, go to the website and see the videos. There are lots of free videos there with the link to YouTube and Facebook. Lots of topics, lots of free live videos. So have a look at them. And now you can start.
Hello.
Hello.
My name is Tasir. I'm one of the doctors in the chest clinic. I'm Mr. David Cooper, 62 years old.
Yep.
I'm here to discuss about your health condition and to address all your concerns. Is it all right?
Yep.
I came to know that you have shortness of breath. Can you tell me more about it?
Oh yeah, it's a breathing problem, and it's what to say and where to start. It's going on for 2 months actually, and slowly it's getting worse, because I thought might be a little bit of cold there. The weather changes, it's sometimes 5 years, sometimes -1. So due to that, and I can see some of my like a friends having cold. So I was thinking that way it's a normal cold. It's more than usual, like a 1 week or 10 days, and it goes on and on and on. I don't know. It's still feeling a bit of short of breath, and that's why I wanted to get it checked.
Right. And do you get the shortness of breath on exertion?
I get even at rest actually. Exertion, it gets worse.
And
Sorry, we're muted. Unmute yourself.
do you have any cough with it?
Yeah, I do have cough. Yeah.
And this is also for the last 2 months?
Yeah.
And is it dry or is it wet?
What do you mean by dry and wet?
And like, do you bring up any phlegm with it?
No, I'm not bringing up any phlegm. It just, yeah.
Just the dry cough.
Uh-huh.
And does it occur at any particular time of the day?
Anytime it can come, but so lately I can see that more was during nighttime.
During the night time. And did you ever cough up any blood with it?
Sorry, what is that?
Did you cough up any blood with it?
Oh, no.
All right. And do you notice any noisy sound from your chest?
Not really, but sometimes only at nighttime, I would say.
Right. And do you think you have lost any weight because of?
No.
And have you noticed any lumps and bumps?
No.
And have anybody told you that you look paler than before?
No.
Right. And this is the first time you are having this cough, or you had this shortness of breath or cough before also?
No, it's only 2 months before I didn't have any problem. Yeah, I had like chest pain and a mild heart attack, but not with the cough and breathing difficulty.
Do you have any acid taste in the mouth
As a test, no, not really.
or any heartburn?
No,
Do you feel that you get like something dripping down back of the nose?
no,
Right. And you also, I came to know that you have some problem with your heart. You said you had some heart issue. Yeah. And do you have any chest pain?
no.
And do you get breathless when you lie down flat?
Yeah, because see, as I said, I'm feeling breathless when I'm sitting down, and then just chatting with you, I feel a little bit uncomfortable. But I'd be there to lie down, and when I lie down, I can't lie down at all, actually. So I'm not sure whether I can't lie down or I'm not lying down due to fear of breathlessness. But I use lots of like 2, 3 pillows at night.
So you have recently increased the number of pillows?
Yeah,
All right. And do you notice any swelling in your feet?
no,
Right. All right. And any change in your bowel habits?
no,
Right. Any change in the waterworks? Is it getting frothy
no,
or decreasing amount of waterworks?
no.
Right. Right. And regarding your past medical history, you said you have is it diabetes? Can you tell me more about it, diabetes?
Yeah, diabetes is like a diet controlled. I don't take any medications for that. So that's under control.
And that's for how long now?
I'd say like 5 years.
All right. And do you notice any blurring of vision?
No,
Any numbness and tingling in your hands or feet?
no,
All right. And do you have any high blood pressure?
no.
All right. And any medication? You're on the medication?
Yeah, I'm on aspirin because, as I said, I had a heart attack in the past. So I'm on aspirin 75 milligrams daily.
Anything else besides aspirin?
No, that's all.
Any allergies to any medication?
No,
Are you taking any over-the-counter medication?
no.
Any family history of shortness of breath?
Both my parents are asthmatic.
All right. And what do you do for work?
Like a 62, but I do building works, and the building works includes a little bit of painting as well.
So how long have you been doing this work?
Oh, this building work is and building and painting. It's going on. Building is going on for like say 10 years.
Right. And have you been exposed to asbestos during your work?
No.
So what specifically are you doing in building work?
So what specifically? See, I'm doing like the usual, putting the foundation on the floors and things, and the pillars and doors and glass and cutting and everything. And recently added a little bit of painting as well. Yeah, it's everything, whatever decoration, inner, outside. Let's say the extension, doing extension, conservatory, everything.
And are you exposed to dust during your work?
Yeah, we'll be there, isn't it? So we can't do the building work without dust, I guess.
Are you using any protection for it? Any equipment?
No, not all the time.
All right. And do you smoke?
Yes.
And how many cigarettes per day?
15 cigarettes per day.
And for how long?
So 10 years.
10 years. Smoking is not good for health, especially it can cause cough, and it's not. I would advise you to stop smoking. If you consider, I can refer to smoking cessation clinic. Would it be all right?
I would say we'll talk about it later, another time. Yeah.
All right. And do you drink alcohol?
No.
And sorry to ask you this question. Have you ever used recreational drugs?
No.
Right. All right. And do you have any pets? Any pets?
No.
No. All right. I would like to ask you a few more general questions. If it's all right with you?
Mm-hmm.
And have you been having any headaches?
No.
Any problem with your vision?
Sorry, what's that?
Any problem with the vision?
No.
Any weakness of any part of the body?
No.
All right. And any joint pain
No.
or any skin rashes?
No.
All right. All right. So what you told me that you had this cough, shortness of breath from last 2 months,
Mm-hmm.
and it has sometimes you have this dry cough associated with it, and this shortness of breath can occur at rest, and there is and also a difficulty in your sleep. You have to keep a number of pillows. You have to increase number of pillows.
Yeah.
Is that right? Do you think anything else I missed?
No.
Right. And in addition to the shortness of breath, have you ever noticed any dizziness?
No.
And have you noticed any change in your color of your ball works? Like,
No.
right. Right. So you said your family history, there is history of asthma, right?
Yeah.
And did you have any history, such history in the childhood, in history of asthma,
No, I don't have any history. No.
or any history of eczema or itchy skin lesions,
No.
or any runny nose or redness of eyes?
Or runny nose will be there all the time, isn't it? Who does not get runny nose? Everyone gets runny nose.
Like a seasonal, any particular season when there's like.
No.
And any increase in body temperature?
No.
Right. And do you have any contact with sick person?
2 minutes more. Repeat that again.
Any contact with sick person recently?
What do you mean by sick persons?
Like some chesty person having cough?
No, not that I know of.
Any recent travel?
Not really.
Okay. So what are your concerns?
Isn't it? So I'm having this for nearly 2 months. It's getting worse and worse. So because I'm not able to sleep during nighttime, it's affecting me. So I don't know what to do and what is it causing. Give me any medications or anything to make them better.
Right. The history you gave me because I need to examine you also. But the history you gave me suggests that you have a problem with your heart.
Yes,
There
sir.
could be a number of possibilities, actually, not just one possibility. One possibility could be because you already have some head problem with your heart. So it could be the the heart has become a little bit weak, and that's why you are feeling short of breath, especially because when you lie down, you feel breathless.
Oh,
And it can
that's
also,
the problem with the heart. Is that worrying?
well, it's something we need to look at. We need to confirm it.
Okay. So at the moment, you're not sure.
At the moment, no, I'm not sure. But other possibility could be related to your work, because you have been exposed to dust for a long time. So that can also result in the shortness of breath.
Okay.
And the other possibility is related to your smoking, because you have been smoking for many years, 10 years,
Mhm.
and that can also lead to a shortness of breath and cough,
Okay.
right? And also we need to look at, because you are taking this medication, that can sometimes, aspirin sometimes cause bleed in the, through
Right.
the,
Yep. 1 minute to collect your thoughts. Time is up. Now, examiner's time. Can you summarize the history for me?
it's Mr. David Cooper, 62 years old, complaining of shortness of breath for the last 2 months. And this is associated with cough, which occurs more at night. He has difficulty in lying down flat, and he has increased the number of pillows when he is sleeping. He also is a construction worker exposed to dust, and is also doing painting for as a hobby. He is diabetic for last 5 years, and controlled on metformin, and also has ischemic heart disease, underlying ischemic heart disease, for which he's taking aspirin.
Okay. What are the differential diagnoses?
So my first differential diagnosis is possibility of congestive cardiac failure, because he has underlying ischemic heart disease, and the shortness of breath is more on lying down, and he's increased number of pillows. And another possibility is occupational asthma, because he's a construction worker, he's exposed to dust, and he's also exposed to paints. And third possibility is of lung cancer, because he's a smoker for a long time. And fourth possibility, acute, maybe he's losing blood through his gut. He's on aspirin, low dose aspirin. So possibility of could be underlying anemia we need to look at.
Okay. How do you investigate?
So I will do a full blood count, liver function test, urine creatinine, urine electrolytes, and I will do ESR, C-reactive protein. I would like to do echocardiography, chest X-ray. I would also like to do a pulmonary function test, and I would also like to do for allergy testing. I can do stool for occult blood to look for any bleeding, screen for blood loss from the gut. and that's it.
Why do you need to do ESR here?
ESR would be raised in malignancy. Also, I would like to do ECG in this patient.
Okay. So how do you differentiate occupational asthma and congestive cardiac failure? Any points from history?
Occupational asthma would be more during the working days,
Okay.
or when he's off the working, he's on holidays. It will improve.
Did you ask for it?
No, I did not ask.
Okay. You said about dust and paint, and you said paint for hobby. Did you say that?
Maybe he's doing at the workplace painting. Yeah, I realized that.
Yes. Okay. So which one do you think might have caused shortness of breath, dust or paint or both?
Paint is recent, so I would think more in the favor of paint. Solvents used that can cause.
Okay. So what do you look for in X-ray?
Chest X-ray, I will look for it will cause more of a interstitial picture, like more of a reticular nodular or glass ground type appearance.
So interstitial picture.
Yeah.
Okay. How do you confirm lung cancer?
Lung cancer, we can do a CT scan.
Yeah.
A CT scan chest. And a sputum, we can do bronchoscopy also if there is any.
Sputum analysis for lung cancer.
Not sputum, but bronchoscopy.
Bronchoscopy. Okay. So what are the features of cardiac failure? Time is up. Right. I think now it's everything off the candidate role, off the examiner role. How is it?
I don't know. I just messed up like up and down. I didn't follow a pattern.
Yep.
I forgot a lot of things, and then I asked at the end. So it was like
that is okay.
Yeah,
As long as you ask, that is okay. But not going here and there completely unstructured will trouble us. We tend to miss a lot, actually.
Right.
So in this history, now it's a question to you and for everyone. Anything else could have been asked in history taking? Anyone you can tell or you text or anything else it could have been asked in history taking? Systems review. What other systems did you ask? Right. There's one, sorry, before that, one reply was the symptoms of work. Yes, that's very, very important. If you are suspecting any occupational health, you need to say, occupational health related problem. We need to ask in terms of, so do you, first question is job, in this kind of job, are you full-time? Do you work over the weekends? Because builders, it's not about the usual jobs. Sometimes people go to weekend and sometimes they won't. And have you noticed any change any time of the day when you're not using paint or not exposure to dust? So in that case, people will tell all the examples. So in this situation, if you have asked me, I would have told clearly. I don't work over the weekends. Weekdays, I'll go allow all the problems. The only time I don't have breathlessness is the weekend 2 nights. I didn't have any problems. So it's directly related to either dust or paint, but more towards painting because it's recently added. Because one of the painters was sick and then I have to do the painting as well. Before I was okay with the distant things. And there's another question here: how are your problems affecting your work? Again, in this situation, it's related to work. It will be exactly opposite. So that's the key point in this situation. Anything else? Systems review. What are the systems?
Cardiac,
Yeah.
chest, respiratory system,
Yeah.
neurology,
Uh-huh.
system, then gastro.
Yeah. Did you ask gastro?
I asked about bowel habits only.
Only. What are the other things you will ask in gastro?
I can ask about jaundice.
Yeah.
Yeah, I can ask about any pain in the tummy.
Yeah.
And itching. That could be part of the jaundice.
Okay. Anything else?
I think reflex. I asked about reflex.
Yeah. You ask about
Change in the bowel.
distension. Something like an aside, this abdominal distension. We are talking about breathing difficulty and CCF. So in this case, abdominal distension. So the reason I'm telling this is a standard like a routine in terms of system means abdominal pain, abdominal distension, jaundice, and then reflex and bowel habits. You said in terms of bowels and vomit, nausea, vomiting. We missed that. Start from there. Nausea, vomiting, everything is important for the G. Respiratory, you told about cough, breathlessness, wheeze, phlegm, dry. See, again, I would avoid terminology in terms of dry or wet because people don't know dry or wet. So we have to ask in terms of, are you bringing up any phlegm? If it's yes, what's the color? What is the quantity you need to ask? Like a small quantity, a large quantity. Large quantity means like how much the bronchiectasis is towards and things like a loads of sputum there. And that is important. And then any blood in this phlegm or the sputum, then we can move on to the next. Cardiac, I am not sure. You asked about palpitations in the cardiac.
I don't
think
remember.
so. But again, that's important. See, everything is important. Palpitation may not be to this case particularly, but generally, if you cover, you need to cover everything. Saying
Right.
cardiac, what else? Shortness a bit already there, chest pain there, and then palpitations you need to ask, and you ask about the swollen legs and things. That's fine. Neurology, clear. Headache, visual disturbances, and then limb weakness anywhere, any of the limb. See, we say like weakness of any part of the body, but I would say be specific. Weakness of any limbs, arms and legs. So any part of the body, what do you expect? I don't know. What do you mean by? So do people tell like I've got weakness in my neck, and then we get stuck? Well, how to respond? What to respond? So be specific. Weakness means any weakness of your arms or legs, and then they will tell you exactly. So respiratory, cardiovascular, GI, and then cardiovascular, we need to ask like a syncope, falls, and like a seizure, unconscious. Everything is important, just like a system review. And GE, in that one abdomen examination, you ask about waterworks and things. Rheumatology, yes, that's very good. You asked about joint pain, skin rash, because sometimes we forget rheumatology. We need to increase rheumatology. And one more system needs to be added. What is that system?
Reproductive.
Sorry, reproductive. Yes and no, depending upon the age and things. But here, say if it is a little bit tricky, you can ask like urinary disturbances. You can ask, but reproductive comes in the sensitive area, and then personal questions, and anything with the endocrine, that's very important. Endocrine important, particularly thyroid.
Where the presence is weight changes.
Yeah, weight change. So yes, you asked about weight changes and lumps and bumps. That's okay. The general malignancy and things, and you asked about fever. That is okay. But endocrine is also important, particularly thyroid, because history taking is a long stage, and you have plenty of time in there. And then that's one or two words about thyroid would do. Any other system? Somebody said hematological. What do you ask in hematology? Yeah, you can unmute and answer if you want. Yeah, hematological. What do you ask in hematology?
Good morning, doctor. The hematological symptoms that I would like to ask mainly regarding to the B symptoms. any reduced effort tolerance, as well as early satiety in terms of splenomegaly presence.
Yeah, okay. So anything particular you can ask? Yeah, particularly you're right, in terms of B symptoms are very important. And then if you are thinking in terms of anemia, like a tiredness, see again, this is a shortness of breath in tiredness and how far you walk. Obviously, mobility is very, very important question. Anybody, it doesn't come in any system, but mobility is a very important question to know what impact patient has to it. Any other system?
Any back pain or
Yeah, we can ask. Yeah.
musculoskeletal?
Musculoskeletal. Any other system? Mental health.
Mental health? Yeah.
So we often forget, but may not be clearly like relevant in this scenario, but it is definitely relevant in cases where, like you ask about like the young patient and coming with a panic disorder, or any patient with the low in mood and things. We have to ask. But I would say generally we have to ask. It doesn't matter whether it's relevant to this particular scenario or not. System review should cover the mental health history as well. So we have to ask in terms of, you have any problems with, and how is your mood? You can start. And what do I mean is, are you feeling depressed, or any history of depression, or any history of anxiety? Whether you, and again in your family as well, they are closely related. We have to ask. Definitely. So in terms of systems, now tell me, what are the systems we will ask?
So neuro,
Yep.
cardio,
Mhm.
respiratory,
Mhm.
and GI.
Yep.
And then the joints and skin rash,
Rheumatology.
renal,
Yep.
and mental health.
Mental health. Endocrine, hematology, musculoskeletal. The vague symptoms are tiredness, mobility. That's we need to ask. So this is about systems review. So it looks like a very big exhaustive list, but it's not. We can tell the patient it is like a one-word question, like a rapid fire question. No, 90% of the time. And within 10% we've already asked. So people may think it's a time consuming, but it is not. But if you miss something, the answer will be unfortunately sitting there. And then we'll be facing the examiner with what to do kind of situation. So I would say cover everything, don't leave any systems, which a quick one, and then get it over there. Right, this is about systems review. Then coming to the problems per se, see, first thing with the breathlessness, any emergencies here? Possible emergency with the breathlessness. Shortness of breath, what are the possible medical emergency?
Pulmonary embolism.
Pneumothorax, also acute coronary syndrome.
Sorry, pneumothorax, acute coronary syndrome. Yep. And you said PE, isn't it?
Yeah.
PE, yeah. So if you're thinking in terms of PE, it's always better to ask in terms of any long travel. You said travel, but particularly, see why you're asking is not a general question, it's very, very specific here. Shortness of breath, you have to exclude PE. Then you have to ask about the long haul flight and things, definitely there. Then people will know you are related to that. ACS, yes, in terms of shortness of breath and how they present and things. Pneumothorax, any, how do you ask? Do you ask any pneumothorax?
Any trauma, any procedures to rule out iatrogenic, and also history of Marfan or connective tissue disorders.
Yeah, trauma in procedure is, yeah, that's definitely that's where any procedure in the chest you had anything over there, and trauma will give us.
Yeah, also comorbidities like COPD.
Yeah. So you can spell it and say in this situation, because even though, see, when you ask about past medical history, people say diabetes, hypertension, and then let's say history of stroke, history of myocardial infarction, ischemic heart disease, everything they can tell. But in this situation, when it's particularly related to respiratory symptom, you can ask, do you have any problem with COPD? And again, smoking history is there. Says not, you ask it. And then again, when you ask about past medical history, I would say list them first, get the list first, and then get into the problem. Because we tend to ask, as soon as people say diabetes, we tend to ask in terms of, okay, is the blood sugar under control? When did the last time you check it? And then are you going to the vision problem? Are you going to the foot clinic and everything checkup? We tend to ask. But I would say just list the diseases first, and then go on to in detail everything, because it will confuse people and they stop telling you suddenly if we interrupt them. So as long as possible, past medical history, try not to interrupt them. Okay. So presenting complaints, history of presenting illness, and rule out any emergencies, the key questions. Past medical history, allergy, medications, and then family history, drug history. In that drug history, it will come like even the medications will come. The other thing, personal history, smoking, alcohol, recreational drugs, and you asked about the over-the-counter medications clearly. And in long station like station 2, there's nothing wrong in asking herbal medications as well. You said about over-the-counter, but always better to ask about herbal, because particularly in terms of, let's say, jaundice and then LFT, dearranged LFT and things, there's something else happening. So it's better, unless we ask, they won't disclose. That's an issue with that. We need to tackle them. And then personal history. So in this case, may not be relevant, but if it's relevant, you need to ask about like a person, like a sexual history as well, in terms of partners, and then whether they use, like whether they are doing like a safe sex and things. We have to ask if it is relevant in those situations. Anything else? And I said mental health, definitely important. Did you ask any surgery? I don't think so. No, that's extremely important. Surgical history. So past medical history and past surgical history. Immediately you have to cover. Okay. Right. So presenting complaints, history of presenting illness, past medical history, past surgical history, allergy, medications, over-the-counter, herbal, family history, social history. You've not asked about social history. Whom do they live with? Do they live alone? What kind of housing situations? Any help? It's completely gone here. And then personal history, smoking, alcohol, illicit drug abuse, and then like a sexual history, and then anything specific like a long travel or pets. And even sometimes pets is a broad term. If you want to be specific in terms of shortness of breath allergy, you can ask birds as well. So if you have pets, people will say only dogs, cats. No, I don't have any pets, but they won't tell about birds. But if you are talking about breathlessness, like alveolitis related to exposure of the like a pigeons or any birds, then you have to ask specifically, do you have any birds at all?
Right.
Okay.
Yeah.
It sounds a lot, isn't it? But it is. We've got plenty of time, because I've told everything in a rattle, and then it's okay. System review, be careful in terms of it has got a separate mark there, because the shorter we do the system review, the mark will also get short. The more thorough we do it, and then people will have a very good thing, because we don't know where the clue lies in. It won't be evident, and there won't be any one problem in station 2. There'll be at least 2+ problems, and 2 or 3 differentials will be there. Right. Okay, any questions? But overall, I would say the feedback, it is good, methodical, but the lots of chunks missing, and you need to do it more. You didn't get any tensed or anything, but you went blank a few times, completely pause. I would say in examination, try to avoid that, because if they start to talk, it's very difficult. They lead you and then question. See, of all things, we have not talked about the diagnosis and the approach and things. So once we get all these things only, then only we can talk about what is the investigations, what is the next step of differentials, and how do you differentiate one after the other. If we have done all these things correctly, then the next part is very easy. No need to worry about it. If we miss anything here, then only there'll be a problem. Because I asked, isn't it? Thought about PE, no, didn't think about PE, didn't ask about long distance travel. And the occupation, you did think about occupational history, but you didn't ask about the weekend, weekday, any difference in day and night and things. See, I was closely giving you clue, but you comfortably ignored that and then went on to the other questions. I gave you a clue. Dust, yes, it's there all the time, but painting is completely new. And somebody was off, and that's why I'm doing it. So I would say a little bit practice again and again. Get a clear thought of mind. 1, 2, 3, 4 like this. You practice all the time, you'll get it. Don't forget mental health history. Because in case of, let's say, tiredness and only the tiredness is there, you explore everything. The clue will be sitting in the depression. Unless we ask about mood, unless we ask about mental health history, we can't find it. So please don't miss mental health history. Just a few seconds. Any history of anxiety, any history of depression, that would be there. Okay, any questions? We are coming to the end of the session. Any questions from you, Tazid first, presenter? Any questions?
No.
No.
So investigations I mentioned, are they right, or do I need to add more investigations to it?
I would say maybe we'll discuss with some other time, because it all depends upon, see, with available information, when the information is correct only, the investigation will be correct.
Right.
When the information is not correct, it's a half done, then investigations won't be correct. At the same time, we can't tell everything, isn't it? You can't tell the blood, X-ray, is there, scans, everything you can't tell. So I would say a little bit, maybe we'll discuss another time. Focus on that. Get the symptoms right. Then depending upon the system only, you can do it other things.
Right.
Right? Okay, so people who joined late, about the way to PACES, we've got a website, www.waytopaces.com, and you can follow us in terms of Instagram, Twitter, Facebook, anywhere. And there are lots of free videos in the website under the videos heading. And we will be doing lots of free sessions like this, and it will be posted in the social media as well. You can go back and see. Okay.
Okay. Thank you, Dr. Ramesh, for the chance.
Right. Don't worry. Thank you. Bye-bye.
Thank you. Bye-bye.
Way to PACES, the right way.